name is Aileen. I'm one of Dr. Golshani's patients. I'm 40 years old, I have 4 kids, and I'm married. After having my first child in 1996, I became pre-diabetic. Since then, I always had struggled with dieting and exercising. My health wasn't so good. Over the years, I worked out, I changed my eating habits, but like always, it's something that has to be consistent that I really struggled with. So after having my 3rd child, things got bad again. I went to do my yearly checkups, and my doctor told me that I was a borderline diabetic, that I needed to fix my dieting. So I did. I lost weight, and then a year later, me and my husband decided to have our 4th child. I ended up getting pregnant. After I had her, my body just changed drastically. I wasn't able to work out and lose weight and get fit again. It was very hard. It was a struggle for me. So I also was dealing with anxiety and depression. And at that time, I feel like I was at my worst. It was hard for me to stay on track. So that's when I started thinking about plastic surgery. It's always been in the back of my mind that I'll get myself fixed one day. But through it all, it was just always a struggle for me to be in public, go places. I was always hiding myself. I wasn't happy. So before the pandemic, I was a makeup artist. Being in the industry, it's not just about the makeup, but also appearance. And it did affect me a lot, knowing that there's just certain clothing that I would wear to cover up my stomach area. I didn't feel girly. I felt depressed most of the time. I always wanted to hide myself. So the only time I would really come out and get ready was when I did have to go to work. Other than that, I was always at home with big t-shirts, big sweats. Wasn't really motivated to get ready. And I just didn't want to be like that anymore. So a couple of years later, my oldest daughter, she had got a job as a surgical tech in a plastic surgery center. And she was able to give me a lot of information about surgery. It was easy for me to ask her, you know, what is the procedures, what is the aftercare and all that. So I started thinking about it even more. In August of 2020, I went in for my first consultation with Dr. Golshani. That was actually the day of my 39th birthday. I was already thinking that I was gonna go forward with my plastic surgery. And knowing that I was gonna turn 40 the following year, it was just something that I had set in my mind that I really wanted to go forward. February of 2021, I did go see Dr. Golshani for a second consultation, and I wanted to move forward with the surgery. So I made my appointment for March 1st. I got a tummy tuck done and also a breast augmentation. And from there on, my new journey had started. It took time. The healing process took time. It's something that Dr. Golshani did warn me about, that it was going to be a journey, and it was, and it still is. I did go through a lot of discomfort, which it was a little scary for me. Also not, I've never had a surgery in my life before, so just going through certain pains and feelings in my body, it was a little nerve-wracking. I think maybe that's why I had some anxiety issues, but Dr. Golshani was always there to answer my questions. And it was like from one day to another. I remember it was like on the 9th week. It was like I woke up and I was myself again. I think it's just something to be prepared for. If you've never had a surgery, especially, just know that your body is gonna have its own feelings, and to stay calm, always ask questions. And and you're gonna be okay. Just follow directions that Dr. Golshani provides. Currently today, I'm 8 months post-op. I'm feeling great. I do feel like a brand new person. During my recovery, since I wasn't able to do much, I was actually shopping online for the things that I would want to wear. I could imagine myself wearing something that I just wouldn't even actually imagine myself wearing. That was something as a woman that made me emotional. I never thought that I was gonna get back to wearing, the type of jeans, the type of tight-fitting shirts, stuff that I would look at others and I would think that looks so pretty, and I couldn't wear it before. The day that I was able to, sorry, the day that I was able to try on something like that, I did cry, and it's still emotional for me. I don't feel like I'm not myself. I feel brand new. I actually feel like I'm myself again. Also, the aftercare of plastic surgery is, your dieting and exercising. That has been very challenging in itself, but it's possible. There's weeks that I go eating clean, eating healthy, exercising, and then I get busy with work, and I get unmotivated, and that's fine. But then you just gotta pick yourself up and move forward again and jump back on it, because it's just gonna make your surgery look better. You pay all the money for it, and it's an upkeep. It's not just get surgery done and then it's over with. It actually has changed my life. When I went in for my second consultation, and I had to do my lab work before my surgery, I actually found out that I had a fatty liver, which I didn't know. So not just did I go through my healing process, I also went through a healing process within myself, like my health. I had to change the way I was eating, and I did, and I lost about, I would say, over 25 pounds after my surgery, and my liver is back to normal, and my health, I feel better. I'm no longer pre-diabetic. During the pandemic, I did have to stop working, which I did get depressed about that, but I was actually blessed to pick up another skill. I started baking from home, and thank God, I was able to still have a job, to take care of my family, and actually also save up for something major that I wanted to change in my life. I feel good. I do feel good, not just, because of the surgery, but health-wise. I think that's very important to know, is that it's not just the surgery that is gonna make me feel better, but being healthy has also put a big input in my life now that I have done the surgery. Since the day of my surgery, I became more healthier. My eating habits have changed. I've been exercising. I've been following Dr. Golshani's instructions of, working out and changing the way I eat, and it has helped me a lot.